Hey everybody,
Welcome back to Medical Monday.
Yeah.
We're excited to bring a very near and dear topic to everybody today. So be prepared to go ahead and like and share, because I know you're probably one of the patients that has this, or you definitely know somebody who does, because it's the number 3 condition we see in healthcare, and it's low back pain.
Yep, 85%
of all people are going to get it. So there's roughly almost 400 million people in America. Do the math, that's 300 plus million patients will have this condition within the next lifetime that we're going to grow as we get, we're kids and we grow up. We see it in kids, we see it in adolescents, we see it in young adults, and of course we see it in our senior population.
Yes, it is quite common, as you can hear, at 85%. It is one of the most common things that we take care of here at the office, but we're excited to talk about it because we want you to learn more, to find out how you can take care of yourself, but also share it with a friend, because you never know when it might help somebody.
When it might help somebody. But to help somebody, we need to figure out, what causes back pain? Like, what's the reason why we have back pain to begin with? Well, let's look at what our back actually consists of.
Yeah, absolutely. So we have a lot of different layers in our body. And so the spine itself has 5 regions, and the low back is the lowest part of moving vertebra. There's 5 of them involved. If you're extra special, you have 6, or if you're extra special as well, you have 4. So but that's an anomaly. We're not here to talk about that.
It's that little curved part of your back there.
If you can move over just a little bit, there we go. That curve, right? So people say there's sway back. So that is part of that sway in the low back. It's
designed for weight bearing, so you want to have that sway. That's normal, that's natural, because you look at the bones here. If you look at it, this is towards the patient's stomach, and this is the bony portion that you can feel in your back. That is where the weight bearing occurs.
Correct.
That's why you have that curve, so that the weight is on this part of your back.
Yes, that is exactly how it's designed. That's what that curvature is for. But you know what moves things? Are muscles.
Yes.
Muscles move joints. The spine are individual bones, and there's a lot of joints involved. So there's multiple layers of musculature involved when we talk about a normal, ideal working low back, with the 5 vertebrae and the multiple layers of muscles.
They're designed to move. That's what it should be doing. We have multiple ranges of motion. We go forward, we go back, side to side. Of course, we have twisting motion, and that's actually a good thing within our back, because those discs need that movement so that they will have very good fluid in there to provide that lubrication and comfort for those movements.
Yeah, there's a fancy word that's used to describe keeping that disc hydrated. It's called imbibition.
Imbibition.
Not inhibition. Imbibition.
No. That too.
Imbibition.
That too.
Imbibition.
Yes.
So that's worth a like and a share right there.
Yeah, exactly. The word of the day.
Word of the day today.
I remember that from TV as a child. The word of the day.
The word of the day today. The first word of the day for Medical Monday is imbibition.
Imbibition.
But what are some things that we do that irritate or can, damage the low back? My favorite one, especially with some of the things I'm going through personally, is lifting injuries.
Because all those muscles are connected to the spine. If you tear a muscle, if you injure a muscle, it's connected to the spine. So now that inappropriate movement or dysfunction of the muscle can lead to low back pain.
Correct. And we got to recover from that. So yes, lifting injuries.
Be smart how you lift. We've always heard, lift with your legs. That's still true today, not just 40 years ago myth. It is true
lift
today.
With your legs. Which brings up our next topic, which is it the hip?
This is a very common question. I had a patient this morning, as a matter of fact. I was like, I don't know, my hip hurt, but then my back. Well, no, I think my back hurt, and then my hip, and it's all over the place. But it's a very common. I always tell patients it's chicken and the egg. Which one came first? If you got hip pain, you're probably going to have back pain. If you got back pain, you're probably going to have hip pain, because those muscles Dr. Gabby was talking about. They function for the movement of that area, and when we have a strain or we have a dysfunction of the muscle, that's a dysfunction of the joint. And guess what? Your low back is a joint, multiple ones.
Yep, correct. And so we need to figure out which one is it and what's causing the problem. And then old sports injuries.
Oh, this doesn't cause injuries. This causes a good time to me.
This
is like fun.
Tis just a flesh wound. But old sports injuries come up all the time as we go through a beautiful process called aging.
Yes. Kids also, we play
Yes.
with our kids. We roughhouse. We play games with them. We play in the backyard. We build things. Of course, there's all kinds of injuries. It's sports related, but really, I kind of like to say it's just life related.
It is life. I love to describe it that way because I don't like to use aging as an excuse for aches and pains. That's just we do get older every moment, but life is what we live, and we do it, and we go, and we discover things later. We're like,
But we
What
should do
happened
those
there?
things. And that's the thing.
Exactly.
As far as 85% of people are going to have low back pain because we all live life. The real question is well, what do we do to prevent it? And then, of course, what do we do to help once we actually do have it?
Yes, because you have joints. We talked about muscles move joints. Even if we have degenerative change in those joints, we can still move the joint. We just need to get those muscles to engage properly. It's a process, but what's great is if you're willing to move it,
It'll get better.
it'll get better.
That's
Very
right.
true. So, awesome. Well, those are some different injuries and things that can happen with the low back and how we can experience this 85% of what happens, the number 3 thing that causes, or that
But if we have
patients are
it,
seen for.
then
So,
what do we do at home?
I love that
A
question.
good thing is that the Washington studies put out a group message, basically, from a large study referencing low back pain. And it said that 70 to 90% of people will actually get better on their own. So that's why we always start. Well,
Yes.
what can you do on your own if you have back pain? Well, there's really the big tried and true for
Yes.
whether it's we want to rest, we don't want to continue to lift those weights, we don't want to continually do what's causing that injury or that pain. We also want to be able to use some ice. Ice packs are very good.
Yes.
Always have one in your freezer. We have a couple of other things here. Compression, which you would see more or less with a back brace to just kind of compress and make it easier to move those muscles, along with elevation. Now this elevation here is a little bit different. So the kid is elevating, and you can't really elevate your low back a whole lot, but really what we're just getting at is those big 4. You want to rest, ice, use some sort of compression, whether it's a back brace, which will also help you recover faster, and the elevation goes to any muscle injury.
Yeah. So that is the good news we have today,
Yep.
right? That
You can do it on your
most of
own,
the time it'll
mostly.
go away on its own. What happens is sometimes the episodes become more frequent, or they become longer.
Yep. That's the
And-
difference between acute and chronic pain.
Yes, and that's where you need help. We can't keep dealing with that same pattern. You need help. Let's fix the problem. So there's a lot of different options out there. Some of them, you got to
Go to
seek-
your primary.
Yeah,
Go ask
to
for help
somebody
from
that-
somebody.
Yeah,
Because
absolutely.
you've tried to rest, you've done the compression, and it's kind of been, 2 to 3 weeks, really about the 7-week mark. We should be realizing that something's not going to get better and we need some help. Well, we can go ask your primary. There's a couple of things that they'll start out with, and it usually goes with medication. So
Yep.
over-the-counter things are always, they're over-the-counter is always good for patients to start with that if that's something that they want to do. But beyond that, then we look at rehab, and we look at a couple of other things that
Yeah.
help with that
You know what?
for the patients.
A lot of patients actually get great results with different types of injections.
Yep.
Steroid injections is quite common. It can go directly into the joint spaces, or almost like a systemic to help with muscle spasms and just really getting the system to relax and calm down. So those are options and quite common as well when we talk about these episodes that just won't give up.
Yep.
And then also what we want to avoid, but is needed in a lot of instances, whether it be trauma or just that chronic of an issue, is surgery. Surgery is necessary sometimes. It's not everybody's favorite.
Yep.
Nobody ever wants to go under the needle, but the thing is it's necessary, it exists, and sometimes you need to stabilize those structures in a different sense. So, but those are some options that,
It's kind of the last resort.
yes.
So we always talk about the
exactly.
last resort, and unfortunately, like Dr. Gabby said, it's warranted in cases. However, what we want to bring today, like every day for Medical Monday, is let you know about what the condition is, how it affects you, and then of course things you can do so that we don't get that last, like this is my last hope, like this is all that I can do that's left, because we want you to stay healthy and happy, and that's the big part of it. It's not just you, it's your friends and family, so make sure and share that with them.
Yes.
But
Yes.
other than that, there's other things besides
Yeah.
surgery or going to your primary. There's a couple of specialized things that we do here, as our name implies, back pain, yes. So there's some very specific things that we do to help prevent and also take care of when you do have that back pain.
Yes. that is exactly what happens. And one of those first things is what you specialize in, and that's trigger point injections.
Yep. So if you look at the muscles, these muscles have dysfunction because of a strain or overuse, and they don't function very well. Well, they also get very tight, and they put inappropriate pull on those bones that they're connected to. We want to relax those muscles so that they don't have that pull. So relaxing the muscles through trigger point injections is what we do here. We do all natural. We do lidocaine and marcaine just for comfort. It's like when you go to the dentist, they numb your gums. But the big thing is Trameal. Mm-hmm. That's 13 botanicals scientifically proven to relax those muscles. All natural, relax. We say it's just melt like butter.
Melt like butter.
That helps because we do everything comprehensive here. It's not just a one-way approach, so that they can get a better adjustment. Because they're going to see a chiropractor. They need that. They're going to do rehab. They need that as well to function with those muscles. So it really helps speed their process along.
Yes, and you are correct. Everything we do here is comprehensive. When they get those trigger point injections, it allows those muscles to melt like butter, which means that stretching and rehab is significantly easier. And so we have specialized equipment and tables to allow us to start to stretch out those muscles, engage them properly, and get movement in those joints that need the support and movement in them, right?
Yep.
You don't use it, you lose it, and if you don't use it properly, other things have to kick in and do a job they're not designed to do.
Those discs have fluid in them. The more movement you have, the actual healthier that fluid is within them. Mm-hmm. So we need to actually utilize our back. And unfortunately, when you go through the process, you showed the picture of a surgery earlier. There was hardware in there that prevents the movement. Or sometimes the number one factor in chronic pain, back pain, is that we don't move it because we are worried about the pain.
Yes.
And that actually kind of makes the chronic pain stick around much longer than what it should.
Yep, you are correct. And then we talked about imbibition and getting movement in those joint spaces. We have decompressive therapy, which actually is specifically designed to open up and pump those disc spaces to get movement in those joints more efficiently and more effectively.
Are these nap chairs? Everybody loves these chairs. A lot of people
actually do take naps in those.
Yes, they're very good. I like the multiple settings you have on them.
Yeah,
so somebody who has a herniated disc on the left side, the table can rotate left or right or just come out straight. Multiple different settings to take care of multiple patients because my back's different than your back.
Correct.
So everything's a little bit different, and it's great to have that very specialized care for patients that have back pain.
Yes, and then you mentioned adjustments. We have a lot of different techniques for adjustments that we utilize here. We can do the manual adjustments that have that popping and cavitation noise that a lot of patients enjoy, but the other end of that is a lot of patients don't enjoy that. And so we actually have some tools specialized for adjusting those patients that don't like the manual adjustments or are actually not great candidates for a manual adjustment.
Say they've already had surgery.
Yep, exactly.
They've already had surgery, and unfortunately they've got hardware in there that prevents that movement. But that spine above and below that hardware still needs to be moved, and this is a great option, which is great for patients so that we don't continue that expanding of that hardware from within that low back.
So we just need to support the function we do have so that we can really definitely support the whole system and get that best function. All right. And believe it or not, as great as it was.
That's all, folks.
That's all, folks.
Another Medical Monday. We're still in the new office. I love it here. You see the background's changed. It's a great place. We had our open house last Thursday.
Oh, man.
Beautiful turnout. Great community support. And we're excited to support the community by continually giving Medical Mondays so that you know what the conditions are.
Yes.
What you can do to help with those conditions, of course, some options out there, and then things that we specialize in to help you with, because back pain should only be temporary. It's not something you have to live with. It's not a part of aging. So don't let your grandma or grandpa tell you, this is part of being old, and let them kind of slowly walk through the process.
That's a horrible excuse.
Yep.
And we'll see you next Monday.
Next Monday.